Many of you may have had COVID during the pandemic, and normally the symptoms appear and resolve in a short period because our immune system is able to clear the virus. However, some individuals, especially those who have immune suppression, do not clear the virus and develop a persistent infection. This individual may test positive and have symptoms over several months or even years. In a persistent infection, the combination of continued virus replication and suboptimal immune control allow the virus to evolve in ways that are not likely to occur in acute infection. Some resulting variants may have greater transmissibility and or be able to escape detection by antibodies. In fact, many of us who study SARS-CoV-2 evolution hypothesize that the virus of concern like Alpha and Omicron originated from persistent infection. Omicron virus are not descended from the Delta virus that was circulating just before the Omicron emerged. Rather, they are related to an ancestral virus that were common about a year before Omicron was detected. Omicron virus appears to be an ancestral virus that underwent significant evolution over a long time, most likely in one infected individual. And viruses from people with persistent infection have even picked up mutations that resemble those in Omicron. To understand why prolonged infection may act as a unique environment for getting highly involved variants, my research using Syrian golden hamster, which closely recapitulates infection dynamics and pathogenesis of SARS-CoV-2 in humans. Other studies have shown that SARS-CoV-2 may have a broad tissue distribution that is not only infects our respiratory tract, but it can also replicate in the brain, heart, GI tract, and among other places. We hypothesize that tissue reservoir play an important role in persistent infection. Several case reports have described patients who test negative for SARS-CoV-2 in nasal swab, but have viral RNA in stool or intestinal biopsies. Based on this and other evidence, I hypothesize that the SARS-CoV-2 can persist in tissue reservoir in some individuals, even when it's not detectable in nasal swab. By using an animal model, we can control the strain and timing of infection. So we know the exact sequence of the virus that initiate infection. We can also perform invasive sample collection to understand the role of tissue reservoir in persistent infection. Through this work, I will be able to understand the frequency in which persistent infection generally highly mutated virus and whether the emerge of the successful variants require an unusual combination of factors does not frequently arise in prolonged infection. In addition, my research will enhance our ability to forecast evolution and provide target clinical intervention for prolonged infection patients.